Emily, and today I'm going to be your student nurse today. Can I have you validate your name and date of birth for me? Pump gloves, hand hygiene, and privacy is given. And his name that my niece gave him is Swaffy, and he was born July 12th, 2005. Excellent. Great. Thank you. I'm going to check your name band for that. Excellent. All right, so today I'm going to be performing a head-to-toe assessment on you. So first I want to ask about your health issues, any history or surgeries. And he would mention that he had a appendectomy or that he has arthritis, things like that. I would make a note of that. And then I'm going to ask what medications you're on. He takes an allergy pill once a day. Okay, excellent. Thank you. Now I'm going to ask if you have any allergies. Are you allergic to any medication or you're allergic to any food substances? No. Okay, great. Thank you. Have you gotten your influenza shot? Okay, great. And you are now over 50, so I would ask if you got your pneumococcal shot as well. Excellent. So what I want you to do is I want you to go ahead and take a smile for me. Smile. Excellent. So go ahead and put your arms out. So put his arms out like this. Excellent. Thank you. So now I'm going to ask about your diet. So what are things that you're eating on a regular day? So they could say that they're on a high fiber diet, a low carb diet, things like that I would take note of. So when I'm checking mobility and gait, I wouldn't ask the patient to get up. I would just assess them as they're getting up to like go to bingo or they're walking down the hall. And to test his speech, he's been talking to me, so I would check that his speech is appropriate. Okay, excellent. So now I'm going to go ahead and check your vital signs, okay? I got this sloth for my graduation. My friend gave it to me, and my niece claims that it's hers, so his name is Swaffy. So, yes. All right, I'll take your blood pressure for you. Make sure that this is lined with the artery. Excellent. Good. And I would check for a pulse first. I would also ask what he normally ranges. So we'll say he's usually regular under 120, 180, over 80. Okay, so I'm going to snap this here. Okay, just go ahead and relax for me, okay? Find the pulse. Excellent. All right, your blood pressure is 121 over 82. Normal range is anywhere between 90 over 60 to 120 over 80. All right, great, thank you. So next what I'm going to do is, next I'm going to go ahead and examine your radial pulse. Okay, so I would take 2 fingers and take his wrist and then roll it over and then listen. So I'm going to go ahead and feel your pulse. Excellent. So your pulse is 63 and your respirations were 14. So typically for a pulse, you're going to be ranging from 60 to 100 beats per minute. And for respirations, you're going to be anywhere between 12 and 20 breaths per minute. So both those values were in the normal scale. All right, next I'm going to go ahead and examine your fingertips. This is so funny. Examine your fingertips for any clubbing. Clubbing is the enlargement of your fingertip, which can mean you have prolonged oxygen deprivation, and you do not have any. Thank you. All right. All right, so do you have any pain? If you could rate your pain on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain imaginable, where are you on that scale? Okay, and patient, he'll say 0. So no pain is noted. So now I'm going to go ahead and feel your skin just for temperature, making sure your skin is warm and dry, okay? Perfect, thank you. And I'm going to go ahead and take your temperature. Okay, so your temperature is 98.6. Normal is anywhere between 96.8 to 100.4. All right, and next I'm going to check for your capillary refill. So I'm gonna press on your fingertip and then release it. And when I press on it, it's gonna blanch it, so the blood will go away, and then I release and the blood will refill again. It should be under 3 seconds, okay? Great, so capillary refill is under 3 seconds. Excellent. Okay, so next I'm gonna palpate your scalp and your, I'll look at your hair and cranium. I'm inspecting for any masses that are possible or any lesions, okay? So I would start at the top of the head and feel around. Good. Let's see. Make sure you can see him. Okay, so. Okay, wait. I'll just lay him back down and then I'll look that way, just so you can see. This wouldn't really be happening, but. So I would feel along the scalp. I would press along here, and then I'd want, I'm sorry, then I would want to feel on the maxillary sinuses on the cheeks and just work my way down and around his face. Excellent. So, so there were no masses or lesions noted. And then I'm gonna have you, and then when assessing for facial expression, looking for symmetry. So earlier when I asked if he smiled, if it was symmetrical, then I would check yes for that. And then I checked the sinuses. Great. So I'm going to ask if you use any corrective eyewear, such as glasses or contact lenses. He would say no, and I would say, all right, great, thank you. So next I'm going to go ahead and check for pupil response. So what I would do is I would take my pen light and block, and I'd ask him to look at my forehead. Good, and then I would walk to the other side to do the same thing. Look at my forehead. Great, thank you. Then I would ask if they have any cataracts or a history of glaucoma, and he would say no. Then I would do the 6 cardinal positions of gaze. So I would ask him to look at my pen light, and then I'm going to go 6 gazes, and he would follow me. Excellent. So then I would just inspect the eye. I'm going to be looking at just the eye structure, such as the conjunctivae, the sclera, the corneas. And then again, I would do the response to light with the combination testing PERLA, which is the testing cranial nerve 3, which is oculomotor, nerve number 4, which is trochlear, and nerve number 6, which is your abducens. So we did the response to light. Now I'm going to do accommodation. So I'm going to have you look at my pen and just follow it. Okay, great, thank you. Okay, so I'm going to ask if you use any hearing aids at all. So he would say no. And then I'm just going to look at the external ear on both sides. So my sloth does not have ears. We're just going to pretend. Okay, good. All the structures look good and normal. Perfect, thank you. So now I'm going to check the internal ear for any blockage or discharge. This could even be wax. So if you have an accumulation of wax, that could mean that your hearing is impaired. So I'm going to go ahead and look inside your ear here. Good, thank you. I'm going to check the other side. Good, thank you. so now I'm going to check your nasal septum, mucosa, and patency. So I'm going to have you tilt your head back for me. I'm just going to look inside your nose here. Perfect. Thank you. You can relax. So facial symmetry, that's already been done when I asked him to smile, so that's intact. Now I'm just going to look at your lips, symmetry and color, which good, I already noticed when I had you smile. Okay, so now I'm going to go ahead and inspect your teeth, gums, buccal mucosae, tongue, and floor of the mouth. So I'm going to ask you to open up your mouth. I'm just going to look inside on the cheeks. I'm going to look at the tongue. I'm going to look at the uvula if it's midline. Good, everything looks normal. Now I'm going to ask you to puff out your cheeks and then stick your tongue out. When you stick your tongue out, I'm looking to make sure that it sticks out straight and it doesn't go to either the left or the right. Good, excellent. All right, so now I'm just going to look at your neck. I'm going to inspect for, oh, no, sorry. No, that's right. I'm going to check your neck for symmetry, masses, and lesions, okay? Just going to check your neck here. I'm going to look on the other side. Good, thank you. Excellent. Okay, so now I'm going to inspect and palpate your carotid pulse, either on one side or the other, okay? So I'm going to do one side first and then the other, not both at the same time. Good, thank you. Good, thank you. Okay, so your carotid rate and rhythm is regular, and also the amplitude is a 2+, so that's normal. Typically we rate carotid pulses on a scale of 0 to 4. So 0 means I don't feel it all, and then 4 means it's just like bounding and really, really hitting the artery wall. But yours, I'm going to say, is a 2+, which is normal, so that's what we expect, so that's great. Awesome, so now I'm going to check for jugulovenous distension. So I'm going to ask you that you relax your neck, so they would turn their neck this way and lay on a pillow to relax so the tendons aren't popping out, and then I would place my pen here, and then I would make sure that there is no shadow casted. Okay, so the other side, relax your neck for me. Excellent, thank you. So no jugulovenous distension is noted. So next I'm just gonna check some basic range of motion exercises. So can you go ahead and move your neck side to side like this? So they would do that for me, and then go ahead and put their arms out in front of them. You do that, and then I would maybe ask them to slide their leg up and down and up and down. Perfect, so range of motion is as expected. Okay, so now on your upper extremities, I'm just gonna check if there's any skin, masses, or lesions. I'll look on your arms here. Good, okay. Great, so now I'm gonna check the strength of the upper and lower arms. So I'm gonna, what I would do is I would pull their shoulders forward and they push against my resistance, and then do the opposite way. Then I would check their elbows, both sides, they would push up on me against my resistance and then push down. Wrists, I would ask them to flex their wrist and push against me. Other way, push against me. Good, so muscle strength is normal and equal on both sides. Typically we rate muscle strength on a scale of 0 to 5+, and yours would be a 5+, which is normal and what we expect, okay? Good. Okay, and now I'm gonna assess range of motion of your neck again. So move your head side to side. Shoulders, can you shrug them up and down? Good, thank you. And then elbows, can you flex your elbows? So they would do this and then extend both at the same time. And while they're doing this range of motion, I would feel for any tenderness, or I would feel for any swelling or crepitation, and they would tell me if any of it is tender. Okay. Oh, and then I would also do their fingers as well. So they would clench their fingers and then open them up, and I would be feeling if there's any clicking of the joint. Cool, so now again, I am going to inspect for turgor on your chest. So I'm gonna pinch on their chest and then let go. Good, turgor is intact. So I would observe for respiratory movement and symmetry, and that can also be done when I'm checking their respirations. I would make sure that their chest is rising and falling at an equal and bilateral rate. So next, what I'm going to do is I am going to auscultate for anterior and posterior breath sounds. So this is where I would hit the like 18 to 26 signs or landmarks on the chest. So I would be listening, start here, and then I would move in a diagonal position just down their chest, listen, and then I would go down and then listen to the bottom of their lungs, bottom of the lungs on the other side. I would also want to check on the lateral side, so I would check their lower part of the rib cage and the upper under the axillary, and then I would do the same on the other side. Here, good. So then I would have them sit up for me, and then I would want to do the back. So I would just listen for a couple. Actually, you don't have to listen for the 18-26, as mentioned in class. So I'd only listen to a couple. So I would listen here, 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 and here. Okay. Good, so what I'm listening for there is any adventitious sounds. So adventitious sounds can be things such as crackling, which can mean there's fluid in your lungs, any wheezing. I would also want to be checking for bronchi, which resembles snoring, and then there's also pleural fiction rub, which means the cavity that your lungs sit in could become inflamed and they could actually rub up against each other. So those would be the things I would be testing for there. And then posterior, and then the heart sounds. Good. Okay. So next I would assess the contour. So I would look from two angles. I'm checking for the symmetry of their stomach. I'm checking along their umbilicus and making sure there's no distension. So next I would auscultate for vowel sounds. So I'm going to start in the right lower quadrant. I'm going to move in the direction of a vowel movement. So the right lower quadrant, hold the stethoscope like this, right upper quadrant, left upper quadrant, and left lower quadrant. And then I would say vowel sounds are either, they would be active, and then if they're hypoactive, that means they're slow, which is very typical in nursing homes. And then if they're hyperactive, they're moving fast. If I didn't hear a sound at all, what I would want to do is listen to each of the four quadrants for 5 minutes to make sure that there is a vowel movement happening for a total of 20 minutes. Good. And then I'm going to just palpate a couple times on your tummy and let me know if you feel any tenderness. Also, I'm just checking for masses here, okay? Good. Good. So no masses were noted. So now I'm going to ask about their eating habits, which I kind of got a little sense of when I asked about what diet they're on. And then I'm going to ask about their urinary and bowel habits, so how many times they go a day, and if it's measured, how much output they have. Cool. Now I'm going to check the lower extremities, so I'm just looking at your legs for any lesions, and I'm also checking for temperature, making sure your skin is warm and dry. So then, yep, and then while I was doing that, I was checking for masses. I'm also looking for any swelling or edema. If there isn't edema, that could be a sign of a peripheral vascular disease. So now I'm gonna palpate some of the pulses here. So I would listen to their pedal pulse if that's there. If that's even hard for me to feel, I could also feel for posterior tibial behind their leg or their popliteal. So next what I want you to do is I want you to separate your toes for me, and I'm going to look for in between their toes for any skin breakdown, which you do not have. And then range of motion, just go ahead and move your toes for me and your ankles. They would like roll their ankles like that and then flex and point their toes. Good, and I already checked range of motion earlier when I had them lift their leg up and down. Gait, I'm going to observe when they're just walking when they have to. Good. And Now I just finished your head to toe assessment. If you have any questions, just let me know.
Cool.